So, dear friends of EPHA, of the Access to Medicines Alliance, dear colleagues, experts, and guests, welcome. I am truly delighted to see you here today in person and online. And I'm looking forward to an engaging dialogue, scientific and political, if you want, on matters relevant to access to medicines. This event couldn't have come at a better time. The revision of the EU pharmaceutical package is the icebreaker nowadays in every discussion in Brussels. We have the opportunity to define how the EU will be bound by law on pharmaceuticals, within which the access, availability, and affordability will be redefined. So the opportunity is before us. Let's see how well we can use it. So today we are hosting the 6th edition of EPHA's Access to Medicines Forum, which is a platform for exchange and dialogue between EPHA members and partners like the WHO, like the European Commission, as well as members of the European Alliance for Responsible R&D and Affordable Medicines. The alliance, hosted by EPHA, strives for the creation of an R&D system that is driven by public health needs and that delivers medicines that are universally accessible and affordable. The Alliance is a free-to-join network established in 2016, and some of those who have been there at the beginning are in the room with us today, that gathers representatives of civil society, consumer, patient, public health organizations, and research institutions. So if you are in the room or online, and you're not yet a member of the Alliance, please consider joining. You can find information at EPHA website, at Alliance website. Please feel free to contact the EPHA colleague coordinating the Alliance. The Alliance is committed to securing affordable prices of medicines, to ensuring safe, effective, and public health-driven R&D through research, advocacy, policy development, and monitoring. The Alliance promotes transparency at the core of the pharmaceutical policy process, but also a transparency for the R&D costs, prices of medicines, and clinical trial data. Now that this shameless advertising is behind us, let's turn to the day. The day will start with scene-setting keynote from the WHO Europe, and it will develop into 2 dynamic panel sessions. So Sarah Garner from the WHO, the Senior Policy Advisor on Access to Medicines and Health Products, will share her view on the future of antibiotics and pharmaceutical innovation, as well as on the EU pharmaceutical legislation. The first panel will then focus on the need for new antibiotics to combat antimicrobial resistance and will discuss concerns regarding the Commission's proposed transferable exclusivity extension vouchers as a costly and indirect pull incentive. We will explore the alternatives, more effective incentives to promote antibiotic development and to ensure access to existing ones. Our second panel will then address the establishment of fair medicines prices, the necessity of transparency in pharmaceutical R&D costs, and the limitations of the proposed EU pharma legislation in disclosing funding, public funding contributions. We will gather experts' insights on improving transparency in the context of the revision. And at the end, I will come back to you with some closing remarks and hopefully with some clear recommendations on the step forwards that we can make together. So let's talk about the effectiveness and fairness of incentives to promote the development of novel antimicrobials and securing access to the existing ones. So thank you for being here. Thank you for your time. That's the most precious good that we have. And I'm really looking forward to this morning's discussion. Tamsin, over to you.